My presentation is on hallucinogenic drugs and the teenage population. So some facts about hallucinogenic drugs is that the drugs in this category include LSD, peyote, psilocybin, also known as magic mushrooms, PCP, and ketamine. They do cause hallucinations, which in other words is just a change in the perception of reality, thoughts, as well as moods. Hallucinogens are a Schedule 1 drug. Basically, this means that there's no accepted medical use and they have a high potential for abuse. They do possess a moderate potential for addiction. They do lead to a high potential for tolerance and psychological dependence, but they do have low potential for physical dependence. Some statistics for hallucinogens, specifically in the teenage population, is by the end of the 20th century, approximately 10% of high school seniors across the United States had reported trying LSD. In Europe, as many as 4.2% of those ages between 15 to 24 have taken LSD at least one time. And then in 1997, 13.6% of seniors had experimented with LSD at least once in their lives. Short-term and long-term physical, emotional, and social effects of hallucinogens include some of the short-term mental effects, including confusion, disorientation, depression, fear, and panic. In some cases, the use of these drugs can result in psychotic episodes. Some physical effects of these drugs include increased heart rate, increased blood pressure, sweating, dry mouth, higher body temperatures, dilated pupils, tremors, muscle weakness, flushed face, goosebumps, and chills. And because of the impact on the brain, hallucinogens can cause lasting consequences such as psychosis or mental disorders. Some consequences experienced by specifically teens as a result of hallucinogenic use include sometimes having flashbacks. These can occur at any time, sometimes even years after taking the drug. Some users may suffer from long-lasting bouts of depression or anxiety for sometimes lasting for the rest of their lives. Some experts believe that PCP and LSD users have some of these things happen to them as a result of brain damage after using the drug. And specifically during a PCP high, users can become violent, disoriented, confused, and extremely dangerous to themselves or others. Some risk factors of hallucinogens include people developing an addiction or a tolerance to this drug or these drugs. People using LSD specifically on a regular basis would need to take higher doses to feel its effect, which can lead to risky behavior, which can result in injury or death due to altered perception of reality when using the drug. And also due to hallucinogens being a Schedule 1 drug, if someone is caught with them or caught using them, it can result in a mandatory minimum sentence of 5 years in prison. Protective factors of this drug include sometimes being combined with psychotherapy. Some hallucinogens such as MDMA, psilocybin, and ayahuasca, may improve symptoms of anxiety, depression, and post-traumatic stress disorder. Symptoms of social anxiety in autistic adults may be treatable with a combination of psychotherapy and MDMA. Symptoms of social anxiety in autistic adults may be Ayahuasca may help alleviate depression and addiction, as well as assist people in coping with different traumas. And then another protective factor is for people suffering from life-threatening cancer. They have found that psilocybin may provide significant and lasting decreases in anxiety and distress. And for the model of addiction, I chose sociocultural model of addiction. This model basically it states that cultural, ethnic, and religious, as well as environmental conditions, are the factors that lead to someone developing an addiction. I chose this model of addiction since I did choose the teenage population specifically. Usually teenagers do try drugs, usually because their friend groups are doing it, and it's just kind of influence. The teens are influenced to use them because the other teens are using them. So this model of addiction kind of centered around that. And then another reason I chose this one was because in the 1960s they had the civil rights era, and hallucinogens were very popular in this time. And then teens who use them today sometimes find themselves just wanting to do what they were doing in that era, and just kind of follow what those people were doing. So that's another reason that I chose that model of addiction. And then the last reason I chose it was because some teens may use the drug because they're just dealing with poverty and other stressors in their life, and that just may be their way of coping with it. And then as far as the intervention technique that I chose motivational interviewing, or MI. Basically, it relies on a person focusing more on their current behavior and how they're feeling and their thoughts and stuff, and not the past or future or what happened or what they were thinking or what is going to happen. It's just what they're thinking and doing at the time. So I chose this because it centers around basically empathy, respect, and positive regards. And teenagers can be very defensive, especially if you're coming at them with an intervention or any type of intervention technique. They can perceive it as judgment. So I feel like this technique would better help them not be so defensive and actually benefit from it more. Another reason is because some of the hallucinogens that teens are using, they can be violent. It can cause them to be violent, depending on what drug it is that they're using. Like PCP, for example. So if they're on it, or they're withdrawing or whatever, if you happen to start intervening with them in that situation, they may become violent. So if you use this more positive intervention technique, it may lead to a better result and avoid a bad outcome. And then the last reason I chose the motivational interviewing is because, in general, teenagers, especially ones using hallucinogens, kind of tend to be more laid back and have a like a whatever attitude. Um, so instead of coming at them with any of the other interviewing techniques, they may be like whatever. Using this one would probably have more of it would probably resonate with them more and be more helpful and beneficial for them, and as well as you actually getting through to them when trying to intervene with them. And then for the last thing, two things that I did learn taking this class. One of them is the different models of addiction. So for someone who's pursuing a career in counseling, if a client does suffer from addiction, it helps me to know some different ways I can go about it and different ways that I can kind of help them and go about making a treatment plan to help them. Even if I'm not counseling for people who are specifically suffering from addiction, it'll help me in the case that if there is, I can better help them. And the last thing I learned, or the second thing that I learned, is the different signs to look for to see if someone who is suffering from addiction. And like I said, even if I'm not specifically working in counseling for people suffering from addiction, that I plan on just doing general counseling for different varieties of people. I know that I'm still probably going to come across clients who are suffering from addiction but don't come in and outright say that. So it's beneficial for me to know what some of the signs are of people who are having this problem, because then I can pinpoint it and address that if that situation were to come. And that's it.